Police in India are investigating senior officials and doctors at a second state-run hospital in Uttar Pradesh. The inquiry was launched after at least 49 children died in just 1 month. The deaths are being blamed on a shortage of oxygen and medicine. The city's magistrate has lodged a complaint against the hospital's chief medical officer and other staff. Poverty and poor health services are a problem in the state. In August, at least 100 infants died at another hospital, causing public outrage. Neeha Poonia is in New Delhi and explains the conditions behind the tragedy.
Essentially, at the crux of this is the problem of health services in India. If you just look at the numbers, less than 1% of India's entire GDP, and we're $1 trillion economy, is spent on providing health services. Now, those who live in cities and towns who can afford better treatment manage to go to private hospitals, but government hospitals are where the real problem lies, because you have a shortage of medicines, often like happened in this case. You have a shortage of other basic amenities. Doctors are not available, you don't have oxygen tank supplies. What else can we expect? If you go by what the parents are saying, it were the doctors on duty. I mean, they're saying that about 49 of those deaths, 19 were stillborn. They're saying that these children and their mothers were not given oxygen supply in time, indicating that perhaps those deaths could have been avoided. You also have 6 children who died after they were born, and the hospital claims that 24 of these infants who died in the last few weeks were children who were transferred to that hospital from others in the district. So the hospital washing its hands of this matter entirely, calling these deaths completely routine. But it is the officials who have to answer why these children and their mothers weren't given medicines in time. Why wasn't there better monitoring of their health parameters? There isn't much outrage. When this incident first came to light this weekend, weeks after the deaths had first taken place, there was only political criticism for the BJP government that is in power, both at the center as well as in Uttar Pradesh. So in that sense, there isn't that much outrage, because there's also a sense of cynicism. This is how, sadly, government hospitals operate in India. And as far as the crackdown is concerned, like I said, this is a source of embarrassment for the BJP government in Uttar Pradesh. First, you had the Gorakhpur incident where nearly 100 infants died. Now you have another incident in another small town in the same state. So yes, they're promising that they will look into these allegations of negligence. But if you look at how the probe took place in the first incident, you have only one doctor who's been held accountable. No one from the government has taken the onus for that tragedy. And the fears are that this is exactly how the probe in this case will also pan out.